Our project's on post-traumatic stress disorder. It's by Karen Hatch and Brittany Edwards. What is PTSD? PTSD is a trauma and stress or related disorder that can develop after someone's experienced a terrifying event. It's normal for people to feel anxiety or fear after a trauma, but with patients with PTSD, those feelings aren't able to dissipate and it starts to interfere with their social and functioning in relationships and at work. These are some of the most common signs and symptoms associated with PTSD. The patients have a lack of interest in doing things they normally were doing, fatigue, anxiety, unable to relax, and start to feel distant from their families.
There are currently no diagnostic lab studies that are used to compile a workup for PTSD. There are case studies working on that now. There's also no diagnostic imaging used for diagnosis at this time, but researchers are working with PET scans to study the brain structure in regards to this.
There's a diagnostic tool used for post-traumatic stress in the clinical setting in VAs across the country. It's a self-administered test that has a point scale of 0 to 5. Any score over 50 is highly presumptive of a PTSD diagnosis.
So some risk factors are being a woman, a veteran, having a brain injury, low income, minorities, people who are abused, people with psych diagnosis, and thus forth. Patient education, we need to make sure we go over with these patients, our stages of grief, med adherence, coping strategies, and the local resources, which are scant in this area. Nursing interventions, we need to make sure that we are going over the main ones, make sure staff is assigned in similar patterns. If it's a rape trauma, make sure it's the same gender and thus forth like that. Sit quietly with the client during flashbacks and nightmares and acknowledge feelings. Assess for self-destructive coping.
There are two types of treatment options for PTSD, psychotherapy and medication, or a combination of both. Psychotherapy aims to reduce the severity of the symptoms and increase functioning. Medications are typically used for mood and behavioral symptoms. There are two medications that are FDA approved. One is Paxil and one is Zoloft. These are two SSRI antidepressants. Cognitive behavioral therapy is a type of psychotherapy. There are 4 techniques typically used, and the recommended treatment time is 10 to 12 sessions. Cognitive processing therapy helps the patient combat avoidance and actually face the trauma itself. Prolonged exposure therapy helps the patient re-expose themselves to the event or traumatic memory. One common technique being used now all over the country is virtual reality headsets. It's used a lot at VA hospitals.
Of the University of Southern California Institute for Creative Technologies, expertise in immersive technologies and emotional storytelling. BraveMind is a treatment option with appeal for today's digital generation. BraveMind
Physical confrontation, the patient could be re-exposed to the traumatic event or situation. EMDR is eye movement desensitization reprocessing. It's where the therapist works with the patient to stimulate the brain while they discuss the traumatic event. Stress inoculation training is a set of skills or methods that the patient is taught to help them in anticipation of a stressful event. Relaxation technique, deep breathing, positive thinking or self-talk, such as I can do this, and assertiveness training. And that's our presentation on PTSD. I hope you enjoyed it.